Hi everyone, I'm Dr. Anshuman Pancholi. I'm a general surgeon and I've been teaching surgery to both undergraduate as well as postgraduate students. I've been helping them prepare for both their prof-based examinations as well as for competitive examinations like FMGE, INI-CET, NEET PG, NEET SS and INI SS. Now this will be the first video of the important topic series for FMGE. Now this will be a video on general surgery. Subsequently, there will be videos uploaded on other topics as well. Along with that, I'll also be uploading the long form conceptual videos for the students who are in their third, fourth and final year. So do like, share and subscribe to our channel if you're new to it so that you can stay updated on all the important topics. So let's start with our first topic, that is an examiner favorite, bed sores or pressure injury. Now this is one of the topics that is very frequently asked across all the domains, whether it is Indian examinations or foreign medical graduate examinations. What all do they ask? They ask you about the pathophysiology, they ask you about the staging of the bed sore and the management of bed sore. Basically, image-based questions are asked and you're asked to identify the stage of the bed sore. Okay, all right. So what all do you need to know? Let's start first with the pathophysiology or the pathogenesis of bed sore. Now, please understand one thing here, beta. How does it occur? You need a constant external pressure. So basically, you have a surface of skin, or basically you have a skin surface which is close to the bone. Whenever there is a surface which is close to the bone, obviously when you have a constant external pressure applied to that surface, the chances of that area being cut off from the blood supply are more. So basically when you have a constant external pressure of more than how much? 30 mm of mercury, that leads to increasing the chances of the occurrence of bed sore. So what basically happens is that the pressure exceeds that of the capillary occluding pressure. So the capillaries are no more able to supply blood to that area. It leads to a decreased blood flow to the skin. Blood flow kam ho raha hai to kya hoga? Dheere dheere there will be ischemia. That will lead to necrosis and finally that will lead to ulceration. So basically it's an ischemic necrosis that causes your bed sore formation. Okay, got the pathophysiology? Okay. Now, the terms that we used to use earlier were bed sores, pressure ulcers, decubitus ulcers, but nowadays the new term that has been adopted and has been used in the textbooks is pressure injury, and you should be knowing that it is a new term. Now what is more important here to know is the staging of bed sores. So basically we use the US National Pressure Injury Advisory Panel staging. What is it? Let's understand. Stage 1 of the bed sore is when you have a persistent non-blanchable erythema of the skin. Skin intact hai, but the erythema, the redness which is there, if you press upon that redness does not go away. That is what is called as it being non-blanchable. Agar press karne se redness chali jati hai, so that is what we call as a blanchable erythema. If it is not going, that is non-blanchable. The stage 1 is a non-blanchable erythema. Stage 2 mein you have partial thickness skin loss with exposed dermis. Pura loss nahi hua hai, it's a partial thickness skin loss with exposed dermis. What is stage 3? Stage 3 में you have full thickness skin loss, but ध्यान रखने वाली बात क्या है बेटा, full thickness skin loss के नीचे आपको subcutaneous fat दिख रहा है, but there is no exposure of the bone, muscle and tendon. That is your stage 3. What is stage 4? There is full thickness skin loss along with the tissue loss. Now tissue loss has also happened, so now you will be able to see the muscle, tendon and bone, and also there can be a loss of muscle also. So there can be involvement of all muscle, tendons as well as bone. So this is your stage 4. Two more important terms that you need to know are unstageable full thickness pressure injury. Here there is full thickness injury, but you cannot stage it. Why? Because jo ulcer ka base hota hai, that ulcer base is covered with a slough or an eschar. Therefore, it is difficult to stage that injury, and that is why it is called as an unstageable full thickness pressure injury. Another term that is important is deep tissue pressure injury. What happens here is it looks similar to the stage 1 pressure ulcer, but here it's not superficial. It is a deep tissue that has been injured because of the pressure or because of the shearing, and that is what differentiates it from the stage 1 pressure injury. Here also there is persistent non-blanchable erythema. It's a deep red or maroonish color that you can appreciate. Got the staging part, beta? Now let's look at the images so that you'll be able to identify them better. What can you see here in grade 1? There is a persistent non-blanchable erythema. फोटो में केवल एरिथेमा दिखेगा, नॉन ब्लांचेबल है कि ब्लांचेबल है, दैट यू हैव टू कंफर्म ऑन clinical examination. Okay, all right. Then what are you looking at here? This is the grade 2 or the stage 2 of the pressure injury, where there is partial thickness skin loss. Next injury that you should know or look at is the grade 3, that is full thickness skin loss है but tissue loss नहीं है. So this yellowish area that you can appreciate here beta, this is what? This is the subcutaneous fat that you can see. Generally grade 3 या grade 4 ही आपसे पूछी जाएगी. This is what are the two grades that are often asked. So grade 3, that is full thickness skin loss. Coming on to grade 4, that is the full thickness skin loss along with the tissue also that is lost. So what you can appreciate here, this is the muscle that you can see here, and that is what makes it the grade 4 pressure injury. ठीक है बेटा, तो अब ये स्टेजिंग हमको समझ में आ गई, हमने क्लिनिकल इमेजेस भी देख ली. नाउ विल बी एबल टू आइडेंटिफाई दीज इमेजेस. कमिंग ऑन टू व्हाट टाइप ऑफ पेशेंट्स आर मोर लाइकली टू डेवलप बेड सोर्स. What are the increased risk factors? Number 1, if the patient is immobilized or paralyzed. If it's a paraplegic patient, the chances are more. Number 2, if it's an elderly patient, again, who is not mobilizing a lot, the chances of injury are more. Third, if the patient is malnourished, the protein loss is there, it's a low protein diet the patient is consuming, the subcutaneous fat pad is also lost, the chances of pressure injuries are high. And lastly, if the patient has poor nursing care or chronic illnesses, those also can develop a pressure sore. ठीक है बेटा? Okay, moving on to the site. This is one of the most frequently asked questions, which is the most common site of pressure injury or bed sore. It is ischium. ठीक है, सीक्वेंस अगर आपको पूरी बतानी हो तो ischium followed by greater trochanter followed by sacrum followed by heel followed by malleolus. Malleolus में कौन सा ज़्यादा इन्वॉल्व होता है? Lateral malleolus is more commonly involved than the medial malleolus. And lastly, occiput. What is the one thing that you're noticing? These are all the areas where the skin is very close to the underlying bone, and that is why we say all of these areas are at more risk of developing pressure injury. Now, 3 more things that you need to know are the names of risk assessment scale. This is a new topic that can be asked in the examination. 3 risk assessment scales होती हैं जो हमको बताती है कि कौन से पेशेंट्स ज़्यादा लाइकलीहुड है उनके अंदर डेवलप होने का, प्रेशर सोर्स डेवलप होने का. Only the names, not the details of it. So what all names you need to remember? Braden scale, Waterloo scale, and Norton risk assessment scale. Only names, not the details. Okay, all right. Next thing that we need to know is the prevention and the management part of the bed sore. This is the last part of it. See, one thing that you need to remember here is that bed sore beta is a preventable injury. That is very, very important for you to remember. Not only from the competitive exam point of view, but from the point of view that if you are working in a private setup and your patient develops a bed sore, that patient can sue you. In fact, bed sores or pressure injuries are one of the most litigious cases that occur in medical practice. So you have to be very careful. Why they are preventable? हमने पढ़ा था, if the constant external pressure is prevented from developing, if you change the position, it is preventable, and that is why it makes it a preventable injury and also the most litigious kind of injuries that happen in medical practice. Okay, now this is what we know. अब प्रिवेंशन में क्या क्या कर सकते हैं? द फर्स्ट थिंग दैट यू नीड टू नो इज दैट यू नीड टू कीप द पेशेंट ड्राई. सो एप्रोप्रिएट स्किन केयर. ड्राई क्या, 2 चीजें ड्राई रखनी है. वी नीड टू कीप द बेडशीट ड्राई एंड यू नीड टू मेक द पेशेंट, द स्किन ऑफ द पेशेंट शुड ऑल्सो बी ड्राई. ठीक है, दैट्स द फर्स्ट थिंग. Next thing that you need to know is to maintain good nutrition. You need to make sure that the patient is having a good nutritious diet. अगर patient bed bound है तो उसको IV form में अगर supplementation करें तो you should make sure that the calorie needs are being fulfilled. Next thing that you need to know is that you need to change the positions very frequently. Frequently से मतलब ये बेटा, you have to avoid the development of constant external pressure. If the patient is bed bound, what should be the frequency of change? Yeah, every 2 to 4 hours you should change the, that is turn the patient. So every 2 to 4 hours for bed bound patient. If the patient is wheelchair bound, what you need to do is you need to teach the patient to lift himself up from the wheelchair after every 10 minutes. For how long? For 10 seconds. So every 10 seconds, for 10 seconds after every 10 minutes. Next thing that you need to know is that bed bound जो patients होते हैं, जो कि आपका एक एक्सपेक्टेड है कि उनके अंदर प्रेशर इंजरी ज़्यादा डेवलप होंगी. So for those patients you need to provide pressure redistribution devices. What are these pressure redistribution devices? Basically, एक ही पॉइंट पे प्रेशर नहीं डेवलप होने देते हैं. सो व्हाट आर द डिवाइसेस दैट आई यूज? वी यूज एयर मैट्रेसेस और वाटर मैट्रेसेस. इसकी इमेज में आपको दिखाऊंगा. एयर मैट्रेस को देख के यू विल बी एबल टू आइडेंटिफाई दैट यू मस्ट हैव डेफिनेटली सीन दिस इन द ICUs और द वार्ड्स ऑफ द हॉस्पिटल्स दैट यू मस्ट हैव विजिटेड. कमिंग ऑन टू द मैनेजमेंट पार्ट बेटा. अब मैनेजमेंट में हम ग्रेड वाइज असेस करते हैं कि कौन सी ग्रेड का प्रेशर सोर या अल्सर है, उसके अकॉर्डिंग हम मैनेजमेंट देखते हैं. ग्रेड 1 है तो इट इज गोइंग टू बी कंजर्वेटिव मैनेजमेंट. सर्जरी नहीं कर रहे हो आप, कंजर्वेटिव मैनेजमेंट है इसमें. क्या क्या करेंगे इसके अंदर? ऑब्वियसली यू हैव टू कीप द एरिया ड्राई. सो कीप द एरिया ड्राई, एयर एंड वाटर मैट्रेसेस, दैट इज प्रेशर रिडिस्ट्रीब्यूशन डिवाइसेस. एंड लास्टली यू कैन ऑल्सो यूज ऑफ-साइट ड्रेसिंग्स फॉर दैट पेशेंट. कमिंग ऑन टू ग्रेड 2 and 3 का अगर पेशेंट है तो याद रखना बेटा, कोई भी डेड और नेक्रोटिक टिश्यू अगर है तो उसको डिब्राइड तो करना ही करना है आपको एनीवेयर इन द बॉडी. सो डिब्राइडमेंट इज सपोज टू बी डन एंड देन यू गो फॉर वैक्यूम असिस्टेड क्लोजर और नेगेटिव प्रेशर वुंड थेरेपी. दिस इज द सेकंड इंपॉर्टेंट टॉपिक इन आवर इंपॉर्टेंट टॉपिक सीरीज दैट विल बी स्टडिंग. सो वैक असिस्टेड क्लोजर और नेगेटिव प्रेशर वुंड थेरेपी. ग्रेड 4 में हम क्या कर रहे हैं? दिस इज वेयर द क्वेश्चंस आर यूजुअली आस्क्ड. Along with the debridement, वो तो करना ही है. You cannot apply VAC or NPWT because आप अप्लाई कर सकते हो, it is not going to heal the wound. You need to replace the gap or which has been formed. जो आपने debridement के बाद जो गैप बचा है उसको भरना है आपको. How do you fill it? With the use of flaps. Flaps कौन सी यूज करते हैं बेटा? Along with a durable sensate skin. So flap transfer with a durable sensate skin. तो कौन सा flap हम यूज करते हैं? We use a tensor fascia lata flap with the lateral cutaneous nerve of thigh. Intact nerve supply उस एरिया की, वो वाला फ्लैप हम लगाते हैं. So this is what is important for you to know. Now look at this image. This is your air mattress that I was talking about. देखा है ना? I'm sure आपने देखा होगा. So this is what is also asked in the examination. What is this? This is a pressure redistribution device. Likewise, we also have water mattresses. Okay जी. Now ये तो हम theory पढ़ चुके हैं. Let us solve one question that has been asked here. What is the question asking? Which among the following is incorrect regarding the condition shown in the image below? It's a grade 4 pressure sore. Is it a true statement? Absolutely true. दिख रहा है आपको बेटा? The entire muscle is also being exposed here. That means the full thickness tissue, full thickness skin loss plus tissue loss. So this is a true statement. Incorrect पूछा है आपसे. Constant external pressure of more than 30 millimeters of mercury leads to the formation of pressure is absolutely true. हमने पढ़ा है अभी. Norton risk assessment scale is helpful in the prevention of pressure sore. That is true. 3 scales पढ़े थे, Braden, Waterloo and Norton. Surgery is the first line treatment for all pressure sores. होता है क्या? No. Grade 1 में हम surgery नहीं करते, debridement की जरूरत नहीं होती है. Why? Because there is no skin loss. There is an intact skin which is present, and that is what is important. That surgery is not the first line treatment. So that becomes your answer for such questions. तो एक ही क्वेश्चन में हमने बहुत सारे इंटीग्रेटेड कॉन्सेप्ट्स देख लिए. Likewise, you need to remember that such questions always test your depth of knowledge. आपको ऐसा नहीं बस ये पढ़ा है कि भाई 30 mm से ज़्यादा का प्रेशर होगा तो डेवलप होगा. You need to know the topic in detail. So these were all the important points that you need to know about bed sores. A shout out for those students who are in their 3rd, 4th and 5th year of their course. Beta, you need to start right now. Do not wait for your course to get completed and come back to India and start preparing for FMGE. Otherwise, you know what happens, you are a part of those group of students who feel FMGE is extraordinarily tough. The pass percentage is low, which is not the case. It is tough because you don't start preparing early. So don't waste your time. सर्जरी, मेडिसिन, पीड्स एंड OBGY, अगर ये 4 सब्जेक्ट्स आप स्ट्रॉन्ग करके आ गए वहाँ से इंटीग्रेटेड तरह से सीखते हुए, तो आई एम श्योर यू विल बी एबल टू क्लियर FMGE इन योर फर्स्ट अटेम्प्ट विदाउट फेल. ठीक है बेटा? यू कैन रीच आउट टू मी फॉर बोथ लॉन्ग फॉर्म क्लासेज एज वेल एज फॉर क्रैश कोर्स at surgeryforfmge@gmail.com. I'll be happy to help you out. Also subscribe to this channel so that you are able to stay updated for such videos. Thank you so much and God bless you.